So what's the difference between getting a cold, and actually having the flu?
So you're right. Both of those have similar symptoms. The difference with the flu is it tends to be a little bit more severe than cold symptoms are. Mm-hmm. So they're both kinds of viral illnesses, and they both cause upper respiratory infections. But it's just that the flu tends to be, it's just more severe symptoms compared to a typical cold. Okay. But you can see the similar symptoms in just a regular cold. They're just usually, a lot of times people who have colds, especially older people, they don't typically get a fever with it. Mm-hmm. Whereas with flu, we almost always see fever with it. Mm-hmm. And the body aches and the fatigue and all those things are more pronounced. Mm-hmm. So if you've ever experienced the flu, you know there's definitely a difference between having the flu and having just a regular cold. Okay. So similar symptoms, but just a lot worse with the flu.
Okay. So how do you know what you have? So you're feeling yucky and body aches and runny nose, and you're just tissue after tissue. How do you know whether it's a common cold or whether it's something more severe?
Well, as far as differentiating between the flu, then, like I said, typically with the flu, you would have fevers and some more severe symptoms. But we actually do, a lot of times in a clinic, we do a test for the flu also. Mm-hmm. We do a rapid flu test, and it takes about 15 minutes to run, and we can actually tell if the person has the flu. Okay. And if they do have the flu, there's a medicine we use for that called Tamiflu, which helps to decrease the duration of symptoms if you start it early enough.
Okay.